everyone for joining us. My name's Hannah with the Women's Professional Rodeo Association, and we're with Dr. Katie Young from Kentucky Equine Research, and she's going to talk to us about some best practices for feeding for digestive health. Dr. Young has done, quite a few Facebook Lives with us. We've gone over everything from feeding in the off season to feeding young horses to tying up.
Yeah,
so we've done lots of different things. So I'll just kind of hand the reins to you, and we'll go through, everything that you've got for us today. And I'm sure we'll have some questions pop up along the way. So feel free to comment on this Facebook Live, and I'll try to catch questions where we have them. And at the end, we'll ask some questions as well. So, all right. Thanks so much for joining us, Dr. Katie Young.
Well, thank you. I'm always happy to be here. And so today we're jumping into it's a very broad subject. So I've just narrowed down to a few topics on equine digestive health. But to start with, my first slide, I thought I've been talking to you guys for about a year now. Okay, why is this not working? Enter, does that? I'm not scrolling. Okay, fine. My computer is frozen up.
Oh no.
There we go.
There it goes.
I thought I've been talking to you guys, and every now and then I talk about my horses, and I thought I will put in a slide so y'all can see, yes, I indeed am a horse person. I am feeding all these horses. There's actually just 3. So I have a lot of the same issues that y'all do in figuring out what to feed my horses. And I run the range from a 6-year-old youngster to the guy on the right, top and bottom. This is my old man who turns 35 in a couple weeks. So lots of feeding issues. So I understand when you guys have questions. But starting out with equine digestive health. So what we're going to talk about today, first off, to really understand digestive health in the horse, it helps to understand their digestive system because they have a very unique digestive system when you compare to other livestock species. So we're going to talk very quickly about architecture of the gut because that's what makes them unique. And then we're going to talk a little bit about some forage issues and basic feeding management because, as y'all know, horses are grazers. And so sometimes the simplest thing to help your horse have good digestive health is just to make sure that forage portion of their diet is correct. And then we're going to move on to some common disruptions to digestive health. And I am sure y'all are familiar with colic and also gastric ulcers. And I'm going to dive a little bit deeper into both of those topics and give you some ideas of what exactly could be going on with your horse when you're dealing with this. And then some feeding and management suggestions to help reduce the risk. And of course, in these situations, the first thing you do would be to talk to your veterinarian, but I'm going at it from an equine nutrition point of view as a nutritionist. And of course, the medical issues, I leave to veterinarians because that is what they are trained in. So first, equine digestive physiology. I'm sure you all recognize this creature in the slide. This is actually a representation of what the horse's digestive system. Livy, of course, wants to add her voice, so she is now getting liver treat. The horse's digestive system, the reason this picture, the dog cow, is put together is because the front part of the horse's digestive system is kind of like a dog, and the back part is more like the front part of a cow. So the way that works, these are the 3 digestive systems. So you see on the left is the cow, in the middle is the horse, and on the far right is the dog. So if you look at the cow's stomach compared to the horse's stomach, compared to the dog's, the horse's stomach actually looks more like the dog than the cow. The cow is a ruminant, and a ruminant has a compartmented stomach. And cows have 4 compartments in their stomach. The biggest one is called the rumen, which is why they're called ruminants. And the rumen is actually a big microbial vat. So when a cow eats food, whatever feed or forage, that goes into the rumen, and it is actually digested by the microbes, the bacteria and protozoa. And those microbes ferment the feed rather than the type of digestion that goes on in the horse or the dog's stomach. So cow, 4 compartments, biggest compartment is the rumen. Rumen is what I call a big old bag of bugs. Horse and dog, this is a simple stomach. There's only 1 compartment. It's much smaller than the cow's. The horse's stomach only just holds a few gallons at most of digesta, and it is a single compartment. And instead of the billions of microbes that you see in the cow's rumen, in the horse and the dog being monogastrics, they have hydrochloric acid and digestive enzymes that actually start the digestion process of the food. So not a lot of microbial fermentation in a horse or dog or true monogastric stomach. Okay, so once we get past the stomach of each of the species, then we get the small intestine. And you see the small intestine of all 3 species looks pretty similar, and it actually functions quite similar. So as the feedstuff leaves the stomach of either the ruminant or the monogastric, we have many, many digestive enzymes that are released either from the lining of the small intestine or from other organs of the body, then dumped into the small intestine. And so the majority of the nutrient digestion, well, I should say much of the nutrient digestion and the majority of the nutrient absorption in the horse in all of the animals takes place in that small intestine. So that's an important point to remember, is the majority of nutrient absorption takes place in the small intestine. So then we get to the next part of the cow. This would be the cecum. In the horse, this very large bag is the cecum. And in the dog, the other monogastric, you see this little tiny bitty thing? That is the dog's cecum. So that's where the horse really is different from all the other species. I should say livestock species, because they are kind of similar to rabbits. The horse has this big vat right where the small intestine meets the large intestine that is a functional cecum, and that's where the horse's microbial vat is. That's where the horse's big old bag of bugs. So there are billions of bacteria and protozoa in the horse's cecum, which should kind of sound something to you like the cow's rumen. And indeed, the feedstuff that makes it into the horse's cecum is fermented by the microbes, primarily the bacteria that live in the cecum, and on down through the rest of the hindgut. We have a more microbial fermentation. Go back, I'm not done yet. So in the horse's hindgut, we have a great deal of fermentation, which breaks down the nutrients that get dumped from the small intestine. So the nutrients or the feedstuffs that don't make it, that are not digested and absorbed in the small intestine, get to the hindgut of the horse, and a large portion of digestion or fermentation and some nutrient absorption takes place in that horse's hindgut. So we call horses hindgut fermenters. So cows are ruminants, dogs are true monogastrics, and horses are hindgut fermenters. Now, why does that make so much difference? When we look at where nutrients are digested and absorbed in the horse, in the upper gut, remember we have enzymes and we have hydrochloric acid in the stomach, and then through the small intestine, we have more enzymes. And so fats in the diet are nearly 100% digested and absorbed in the horse's upper gut. Now, carbohydrates, we have 2 classes of carbs. We have the sugars and starches, the basically soluble carbohydrates, or sometimes not called non-structural carbohydrates, are primarily digested in the upper gut, in the small intestine of the horse, and that's where we want them digested for the most part. Those carbs, the soluble carbs are broken down into glucose and simple sugars, and then those simple sugars are absorbed from the small intestine. Now, something to be very aware of is in the horse, there is no appreciable fiber digestion in the upper gut. When you think about that and think about a horse's typical diet, they eat a lot of forages, typically grass or legume forages, which provide a lot of fiber in the diet. But in the horse, there's no appreciable fiber digestion in the upper gut. The fiber, for the most part, passes undigested into the hindgut, and then the microbes actually ferment the fibers in the hindgut. Now, protein is primarily digested and absorbed in the upper gut, and in the upper gut, when the protein's broken down, it is absorbed as amino acids. So horses do not have protein requirements, they have amino acid requirements. So we want that absorption of amino acids in the upper gut, in the small intestine. Now, in the horse's hindgut, where we have microbial fermentation, we do have the fiber fermentation by the microbes, and the fibers are broken down. They're not actually, although fibers are made up of sugars, the microbes do not break down the fibers into sugars. They break them down into volatile fatty acids, and those VFAs are absorbed in the hindgut, and that's a very important source of energy, especially for maintenance horses. So a horse that's not working hard, or a non-lactating mare, can actually usually get enough energy from the volatile fatty acids from the fiber in the forages to maintain body weight and their functions. Working horses, lactating mares, and late pregnancy mares often cannot get enough calories just from the fiber and need additional calories from some sort of grain or fat in their diets. The other carbs that we deal with in the hindgut is if there is an overflow, if the horse is eating too much sugar and starch in a meal, that it cannot be, there's just too much volume to be digested and absorbed in the upper gut. The overflow can get into the hindgut, and for the most parts, the microbes in the hindgut are not set up, the populations are not such that they can handle a large sudden amount of starch and sugar to ferment, and then we can get colic, possibly laminitis in the hindgut. So that's our first type of digestive disturbance that we can get just due to the architecture of the gut. And just to mention protein, in the hindgut, the microbes do break down protein, but there's really no absorption of amino acids in the hindgut, and the bugs don't really break down the protein into specific amino acids. They kind of tear the protein apart, and we have nitrogen and a carbon skeleton left. The carbon skeleton can be used as energy or building blocks of other molecules by the horse. The nitrogen, for the most part, is absorbed into flushed out as urine. So that's what happens to protein in the hindgut. Another thing just to mention, this is a little drawing I did a million years ago that kind of shows things in relative size and where they're set up in the horse's body. And it's not exact, but I left out many, many feet of small intestine because in reality, this is 60 to 70 feet long in the horse. But you can see the very small stomach, small intestine, there's the cecum, and the rest of the hindgut leading out into the rectum. And if you look at this part of the horse's hindgut, you can see how wide that tube is at that point. So, feed stuff, digesta would flow through very freely. Then it gets to this little area called the pelvic flexure, and you can see how wide it is there and how narrow it is here. And in reality, this makes a hairpin turn in your horse's abdomen. So if you think about it, what would you do to the plumber if they set up your kitchen plumbing that way? And then you started dumping a bunch of food going down the disposal, and that's just absolutely set up for feed stuff to get stuck in a big wad. So the pelvic flexure is actually, that's where the majority of impaction colics can happen. So that's what I wanted to go through the gut so you understood the digestion in the first place. And secondly, just the anatomy, the architecture, why it's an odd design and horses can be so prone to things such as impaction colic. So having said that, forage considerations, when we think about the base of all horses' diets is forage. That's what they're designed to eat. And when horses are fed kind of as Mother Nature intended, and they live the lives that Mother Nature intended, the risk of digestive disturbances actually does decrease. So if we want to try and mimic Mother Nature as much as possible, we want to make sure that they get adequate forage. We need to think about the amount of forage. The recommended minimum just for digestive health is 1.5 to 2% of their body weight. So for a 1,000-pound horse, that's 15 to 20 pounds of hay. Water is very high moisture content, so it could be about 3 times, grass is high moisture content, could be about 3 times by weight of grass, fresh grass as hay. But that's still, that's a lot of forage that the horse should be getting. Now, you can drop below that. In general, the minimum forage or hay we would recommend for a horse would be 1% of their body weight. But when you get that low, you need to be very management intensive to make sure you're getting it in a way to minimize digestive disturbances. And the other thing to consider is quality. Poor quality hay is very fibrous. It's not digestible, and it may be so high in completely indigestible fiber or lignin that even the microbes cannot ferment. And when we have very poor quality hay, remember that pelvic flexure, if there's a big amount of indigestible matter going through, that raises the risk of impaction colic. On the other hand, if you have extremely high quality forage, sometimes in the spring, the really lush green grass can be very high in soluble carbs. And if the horse's digestive system is not accustomed to that, you can get similar to that starch overload from a big grain meal and increase the risk of colic. So we want to think about the forages that our horses are getting and make sure we feed to minimize digestive disturbances. And so to just understand the quality of hay, a lot of times people think about, well, I need to get my hay tested. Well, you don't necessarily need to get your hay tested every time. That's not, it's really not feasible for horse people for the most part. So, but to understand the quality of the hay, it helps understand the factors that influence the quality of the hay. So I've got a question. Here's, what is the most important factor influencing the quality of hay? Is it fertilization or climate conditions? Or possibly age, how long it's been since it was cut? Is it a year-old hay? Is it 6-month-old hay? Is it 10-year-old hay? Storage conditions, was it stored outside? Is it inside? Was it rained on? The plant species, grass hay, legume hay, alfalfa. These are all important things, but in reality, none of those are the most important factor. It is the maturity at time of harvest, how old the plant was when it was cut, because the younger the plant is, the least mature the plant is, the more digestible it is and the more nutrients the horse can get out of that hay. So very mature hay is going to have more indigestible fiber. Very immature hay is going to have more protein, vitamins, minerals, and also soluble carbohydrates. So very immature plants are more at risk of soluble carbohydrate overload to the hindgut, and very mature plants are more at risk for impaction colic. So for horses in general, you want good quality, but not like dairy quality hay. For dairy quality hay, I recommend that is fed to dairy cattle. And you want good quality and not the best, and definitely not the worst. So some characteristics, and these pretty much, if you go through them, it has to do, most of them have to do with how mature the plant was when it was cut. High leaf to stem ratio, the older the plant is, the more stem it has compared to the leaf. Small diameter stems, same thing, the older it gets, the bigger the diameter. Few seed heads or blooms, I am kind of interested because one of the ways we recognize Timothy hay, which a lot of people really like Timothy hay, is that that very definitive seed head for the Timothy. And at that point, if you see a lot of Timothy seed heads, then that's kind of overly mature plant. Fresh smell and appearance, cleanliness and color, those kind of give you an idea of things like storage condition or how old the hay is, because you want it green, you want it to smell good, you want it to be free of mold and other trash. It's to have ideally kind of a green color throughout the bales. Sometimes if it's outside, it gets yellow on the outside, but you open it and it's still nice and green and smells good. And so that's fine. It's just a little oxidized on the outside. And you want it to feel pliable and soft. The older plants and the older hay gets really not like sticks, and you grab a handful and you squeeze it and you go, oh, this doesn't feel very good. And your horse doesn't really want to eat something that is that hard to, but it does give you an idea. If it feels very sticky, then it's usually old, more mature, poorer quality hay. Okay, so having said all that, what can go wrong in the digestive tract? Well, some of the common ulcers and the two that were the issues, and the two we're going to really get in depth here, are gastric ulcers and colic. So we're going to start with gastric ulcers because I thought let's start it closer to the beginning of the gut and then we can move back. So equine gastric ulcer syndrome. And I put these pictures in because the horse, this is the same horse, and these little stomach diagrams really kind of illustrate, if you scope that horse and looked at him, this is what it, and this horse was scoped, and you can see there are gastric ulcers, and that's kind of what that horse looked like at the time. It was hard to keep weight on. He just kind of had an unpleasant attitude, and kind of just in his stance, that's indicating he's in a bit of pain. He's just not comfortable. And then after treatment, cleaning up the ulcers, this is what the horse looked like. He's more pleasant. He's gained some weight. So that's the kind of thing that we tend to see with equine gastric ulcers. And some of these horses are so stoic, they don't really tell you what's going on. And so you have to be a bit of a detective and say, there's something a little bit off, and perhaps it's ulcers. So equine, some of these conditions you have to really keep up with because the nomenclature keeps changing. And so it was known as equine gastric ulcer syndrome, but that's really an umbrella term because it's now been separated out into two different diseases: equine squamous gastric disease and then equine glandular gastric disease. And it depends on where the lesions are in the horse's stomach. So in the upper portion of the horse's stomach, or the dorsal portion, this is the squamous part of the horse's stomach. And so that is where the lesions would be ESGD, the equine squamous gastric disease. And these type of ulcers are the best understood and described at this point. So when you are researching on gastric ulcers and you're finding recommendations and information, for the most part, what you're finding is on these ulcers that take place, that are found in the upper portion of the horse's stomach. The glandular, equine glandular gastric disease affects the lower or ventral portion of the stomach, which is down here. They are less well understood and described. They are seen with endoscopy, but the why they are occurring is not well understood. It's not directly related to feeding and management from what we can tell at this point, and is caused by a breakdown of normal defense mechanisms in that lower portion of the horse's stomach, and possibly bacterial infection. Prolonged use of non-steroidal anti-inflammatory drugs can cause these lesions in the lower stomach. But the typical things that you hear about for reducing the risk, other than reducing the NSAIDs or watching the use of NSAIDs, we don't really know at this point. to understand kind of the horse's stomach, that lower portion is the glandular portion, and that's where the hydrochloric acid is produced that I mentioned that is a typical part of digestion. And the glands in the lower portion produce hydrochloric acid. They also produce basically a mucus that lines that portion of the stomach, and it protects that lining from the acids that are a part of digestion. Now, in the upper portion of the stomach, that is non-glandular, so it looks different. And I've got some pictures in a couple slides, but there's no hydrochloric acid produced, but there's also no mucus and protective covering. So down in the dorsal portion, well, up in the dorsal portion, you have lining that's not protected. In the ventral portion, you have the mucus and it's protected, and you have the hydrochloric acid. So what could go wrong there? Well, unfortunately, the hydrochloric acid can get up into the upper portion of the stomach and can cause lesions. So acid splash on the unprotected upper portion of the equine stomach, possibly volatile fatty acids. There are some microbes in the stomach that ferment some soluble carbs and produce volatile fatty acids, but primarily it's from the hydrochloric acid. And we know that because if you remove the hydrochloric acid that is produced in the lower part of the stomach, then you can cure the gastric ulcers regardless of VFAs. Now, I do want to mention at this point, I'm going to really be concentrating on the equine squamous gastric disease, because in the glandular portion of the stomach, we know so little about those ulcers at this point that I don't really have a lot of feeding and management recommendations. Work with your veterinarian. When the vet scopes the stomach and they see those glandular ulcers, there are medications that can help those ulcers. For the most part, the typical recommendations that you get are, again, for the equine squamous gastric disease or the ulcers you find in the dorsal portion of the stomach. So again, hydrochloric acid is the primary cause. And when the horse is given omeprazole, that actually causes the cessation of the HCl. And so there's no acid produced at that point. So that is what is causing those ulcers then to be able to heal. You can't do that forever, because the hydrochloric acid does have a role in digestion. So you don't want to keep a horse on omeprazole long term. So there are other things to do to help mitigate the risk of gastric ulcers in horses. But just going through the prevalence of gastric ulcers, and again, this is the squamous portion of the stomach. We're not dealing with the glandular portion, so this upper stomach. Up to 93% of thoroughbred racehorses, and these are different studies that just looked at different categories of horses, and there are a lot of studies out there. And then this specific research combined a bunch of studies to try and get some ideas. So thoroughbred race horses, high-level endurance horses are very high risk. Standard bred race horses are also high risk. Show horses, you see, are 53%, three-day event horses, 42%. Elite Western performance horses are still 40% chance of having ulcers. A lot of horses have ulcers, and as I mentioned, a lot of horses are very stoic, and you don't necessarily even realize that ulcers are going on. But I will talk a little bit about some things to look for that might give you an idea that your horse may have ulcers.
I have a question, Doctor.
Sure.
So with that slide that you just had up, is there a reason for, some disciplines being higher chance, or, anything like that they've found?
That's a really good question. And yeah, there are a lot of potential causes. And as we go through some of the risk factors, this will come up again. But to some extent, the diets and then the lifestyles of these horses and the workloads of the horses, when you have horses just out in pasture, doing very little for a living, the risk of gastric ulcers is a lot smaller. But there are diet and diet management issues that can increase risk of ulcers. And then there are exercise issues that can increase the risk of ulcers. And so that's why you notice these are all performance horses that tend to be higher risk of ulcers. So I'll get into that in more detail in just a minute.
Perfect.
Okay, so this is just to talk about the pH in the stomach. And when feed is withheld, the pH can really drop down, which means it's much more acidic. So when the pH is 4 and above, the stomach is considered buffered. And so if the fluid from the stomach, when it's buffered, splashes up into the upper stomach or the non-glandular portion, it's not going to cause lesions. But when you look at, okay, this is just an empty stomach, so over 24 hours, how much time is the stomach, is the acidity level such that it could be problematic for the upper stomach? Much of the time it really is. So horses, when feed is withheld, are at a much greater risk for gastric ulcers, which sometimes that can be a little bit of a problem, because if you're going to have your horse scoped for gastric ulcers, one of the things they do is have you fast that horse so that they can actually see the lining of the stomach. And sometimes ulcers can come on so quickly that just the actual fasting your horse may develop ulcers. Light exercise also reduces the pH. So above a walk on this chart, you can see here, we've got pH of 7, start exercising, and that pH just drops. So that period of time when the horse is exercising, the pH is very acidic again. So at that point, if the acid splashes on the non-protected part of the stomach, it certainly can cause lesions. So I'm going to go back here. One of the things that can help is that when the horse is on adequate roughage, forage in the diet, you get this fibrous mat, because remember, the fiber is not digested in the stomach or small intestine. So you can get a whole mat of fiber that just it's kind of lightweight. So it just lives here and kind of floats at the top of the acidic liquid. And so if the horse is in a fed state, then that mat can reduce the splashing of the highly acidic acid up onto that non-protected portion of the stomach. So exercising on an empty stomach is not the best idea. Okay, so some clinical signs associated with the gastric ulcers would be poor appetite, picky eating, poor body condition, weight loss, chronic diarrhea, poor coat condition, bruxism, which is grinding of the teeth, behavioral changes, which would be if your horse kind of gets aggressive and nippy, or just nervous behaviors, biting its sides, girthiness when you go to cinch them up and they get cranky and they pin their ears and they reach back. All of those things can be indications of pain caused by ulcers. Sometimes acute or recurrent colic can be a symptom of gastric ulcers. And then just poor performance. Your horses, you're just not getting the kind of performances that you were getting. And these pictures, I must say, I stole these from a presentation that Dr. Ben Sykes, who's an Australian veterinarian and researcher and one of the leading experts on gastric ulcers in horses. And he's got some excellent presentations available on his Facebook page, actually. But this is endoscopy, gastric endoscopy. This is a stomach that is not exhibiting gastric ulcers. This is the lining of the stomach that over time there has been some gastric ulcers, because there's this yellow, I think it's keratinization, shows symptoms of previous disturbances. This is a horse with active gastric ulcers, and they're not tremendously severe. And as we move to the right, these are more severe, and this is just a chronic case, long-term, extreme gastric ulcers. And this is a horse that has to be in a tremendous amount of pain. So some common risk factors. What can increase the risks associated with equine squamous gastric disease? Okay, looking at the little schematic here, the red arrows indicate increased abdominal pressure. So when you're in situations that you get this pressure on the horse's stomach, that pressure can help push up and splash the acid on this unprotected region of the stomach. So, and right around here, especially if you have that fiber mat, you're going to have a pH of 4 to 6, but down here in the lower portion of the stomach, that's where you get the really acidic pHs of 1 to 2. So exercise, when the horse is exercising, there's definitely increased abdominal pressure that is going to possibly splash the acid up on the unprotected portion. Inadequate forage, either quality or quantity of forage, you are reducing that fibrous mat that can be protective. Lack of pasture access can possibly, the pasture access can have a protective effect, but it's variably reported. There are reports of horses that were on pasture that still were actually having increased gastric ulcers in that upper portion, the ESGD. Large meals with high starch content can, the theory there is we increase the acidity, possibly with the fermentation of the starch. This is semi-fasting, greater than 6 hours between meals. That means that there is not the food stuff in there, buffer, number one, buffering the acid, and number two, having that fibrous mat. And I should have mentioned at some point that you do get buffering of the acid from either having the food stuff in the stomach, but also when the horse chews, they produce saliva, and the saliva has bicarbonate, which is also a buffer. So the act of chewing will help buffer the stomach, and then having the feed in the stomach also helps buffer. Fasting, of course, really increases the acidity and leaves no protection for the upper stomach. Horses that are kept on or actually kept primarily in their stalls, or they're all on stall rest, those horses tend to have a more acidic stomach and more risk of gastric ulcers. And then water deprivation or intermittent access to water can increase the risk of the equine squamous gastric disease. So how best to manage these risks? So we want to implement management and dietary, sorry, I'm messing around with my little light. Implement management and diet issues to help induce healing and prevent reoccurrence. That's what it's all about, to help ulcers heal and prevent reoccurrence of ulcers. I will say, in my opinion, there are two things that can heal ulcers in horses: medication, working with your veterinarian, of course, for that, and then sometimes Mother Nature. If you reduce the risk and take away the reason the horse is having ulcers, then given enough time, sometimes Mother Nature can help these ulcers heal, but not always. Sometimes you really must have medical intervention with your veterinarian. So some other things to do is to plan your exercise, because exercising on an empty stomach is higher risk. Now, for high performance horses, you don't necessarily want to feed a grain meal right before exercise, but having some sort of fiber in the stomach, so like a small forage meal before exercise, does help reduce the risk of gastric ulcers. Anticipating stressful events, travel, competition, intense training, and take some preventative action. Provide as much turnout as possible, preferably with one or more horses. The horse is not turned out all by themselves and very stressed that way. I will mention stress has certainly been implicated with gastric ulcers, but usually not with as much with the non-glandular ulcers as it is with the glandular ulcers. And that's something that's not well understood at this point. But quite honestly, if you're trying to reduce ulcers in general, gastric ulcers, then reducing the stress that your horse goes through is very helpful. You want to keep a regular schedule for feeding, grooming, exercise, etc. That couple things that helps with having feed going through the GI tract on a regular basis. And then that helps you in planning, for instance, so that you don't exercise on an empty stomach. Provide continuous access to clean, fresh water. There are very, very few times that having plenty of water is not recommended. And quite honestly, at this point, I can't think of any. Always have good, clean, fresh water available to your horse. Avoid the use of paste and water-soluble electrolytes. And this is one you have to kind of think about, because if your horse is exercising hard and is sweating, you do want to use electrolytes. This is one more that if you know your horse has a history or is currently suffering from gastric ulcers, electrolytes can exacerbate. They're not going to cause gastric ulcers for the most part, but think about it as putting salt on a wound. It can certainly make it hurt. Practice good parasite control. Consult with your veterinarian before administering NSAIDs. Again, these may have more with the glandular gastric ulcers, but still overall in managing the risk, these are things to think about. And if the horses are stalled, utilizing slow feeder hay nets can be helpful because it slows down the horse in their forage intake and hopefully spreads out the amount of time that the horse is eating its hay. And so you've got that fiber mat more long-term in the stomach as a protective measure. So nutritional management, still never allow more than 6 hours of fasting, provide frequent access to good quality hay and or pasture, incorporate alfalfa hay into the diet because alfalfa has been shown to have a buffering capability on the stomach. Don't really know if it is the higher calcium content of the alfalfa or it could be the higher protein content of the alfalfa, but research has shown that alfalfa does have some buffering capacity. And so 1 to 2 pounds, you don't have to switch completely to alfalfa hay, or it can be alfalfa pellets, alfalfa cubes, but just 1 to 2 pounds at about 5 to 6 hour intervals kind of helps keep that buffering capability through the day. Feeding small, frequent meals, 3 to 6 per day. If you've got a horse that does have chronic gastric ulcers, again, this kind of spreads out the feed in the stomach, and you are, with the smaller meals, you're lowering the soluble carb content of a single meal. Of course, providing continuous access to water, sometimes utilizing higher fat and fiber concentrates to lower the total soluble carbs in the feed can help. And of course, consider research-backed nutritional supplements that can really help buffer the stomach, can help buffer the hindgut, because there also you can get ulcers in the horse's hindgut. And I'm not talking about those at all today because that's a whole different topic, and hindgut ulcers are really not well understood at this point. But there are times that buffering the hindgut can be helpful for digestive health. So, and I will talk a little bit more a little later about the supplements that KER has to offer to help with digestive health. Okay, so leaving ulcers and moving to colic. And this quote, I used to teach horse management and feeding basic horse management courses at Texas A&M. And I remember one of the slides that I stole from the previous professor, and the whole slide just said, colic is a disease of mismanagement. And I think that's a little broad, but in many, many cases, it is true that managing horses correctly in using all the best management practices can really greatly reduce the risk of colic in horses. I say that, but in reality, there are times the weather changes drastically, the barometric pressure, or I'm in Kansas. I think in this next week, we're going to go from a high highs in the 30s to we got a day that the high is going to be in the 70s. So those kind of ridiculous changes we have no control over. So sometimes I think it's Mother Nature's mismanagement and we can't do a lot about that. However, there are a lot of things we can do to reduce the risk of colic in our horses. Now, what is colic? Colic is just, it's abdominal pain. The horse's belly hurts. There's a lot of different reasons that the horse's belly can hurt. So colic is really an umbrella term. The symptoms of the horse hurting would be, and I think probably most everybody who's listening here at some point has had some sort of experience with colic. If you're in horses for very long, you're going to see a horse with colic. But the symptoms would be pawing, rolling, sweating, reaching around, biting on his sides, biting on his flanks, just general distress, uneasiness. Sometimes they're just sitting there and their weight is shifting and they just don't seem right. Lack of defecation if they are not pooping. Absence of gut sounds. So there's something going on that the gut motility is compromised. Loss of interest in food and water. These are all just general symptoms that something is going on, the horse is uncomfortable, and there's some sort of pain in the belly. So the causes of colic, basically any kind of distension, obstruction, or malfunction in any part of the digestive tract can result in colic. So problems in the stomach, about 12% of colics are related back to problems in the stomach, and many of those are probably due to gastric ulcers. In the small intestine, about 33% of colics are attributed to small intestine. Hindgut malfunction, about 55% of colics. We see more colics in the hindgut than anywhere else. And one of the things when I was talking about the architecture of the gut that I should have mentioned, and it's another difference in the horse's gut versus other creatures. Most animals, the tubes of the gut, the small intestine, large intestine, are held in place by membranes. And in the horse's gut, it's really not. Those tubes, if you think back to the picture of the gut, those tubes can wrap around and move around, and they can actually wrap around and get stuck on itself. And it can twist, and it can cause an impaction because it's twisted and the feed can't flow just because of the twist. Sometimes it twists and it cuts off the blood supply. So again, the architecture of the horse's gut is just very tricky, and it leads itself to having problems. But that's one of the hindgut malfunctions. I had a client years and years ago that the horse's hindgut would move around, and a piece of the gut would actually get hooked over the spleen. And I think after that happened 2 or 3 times, the solution, they did surgery, and they actually sewed down that piece of the gut so it couldn't wiggle around anymore. So lots of things can happen in these lovely horses' gut. Okay, so potential causes of all these things. Overflow of undigested soluble carbs into the hindgut. So if you feed a horse a large meal that's high in non-structural carbs or soluble carbs, and you overload the capacity of the stomach and the small intestine to digest and absorb the sugars, you get all these soluble carbs into the hindgut, and it just is such a shock to the microbial population in the hindgut that it shifts the population, and you get a large growth of the bugs that digest soluble carbs, and you get more lactic acid produced by the fermentation of soluble carbs, changes the acidity of the hindgut that can kill off the normal microflora that tends to digest the fiber in the hindgut. And as those bugs die, they release endotoxins into the hindgut, and it just is a mess. And that certainly can result in colic and possibly laminitis. Sometimes limited forage, an empty stomach, increased risk of gastric ulcers. That can all happen from an overflow of soluble carbs. or too much forage. If, again, you've got lush green grass that is very high in NSC, and especially if horses have been kept up away off of the pasture and then get turned out on this lush green grass. And it's not always, sometimes in springtime, sometimes in the fall, you get grasses that are very high in soluble carbs and the horses gorge on them. So again, you can get overflow of soluble carbs into the hindgut, resulting in colic and possibly laminitis. So poor quality forage, that very fibrous forage, lends itself to impactions. Remember the architecture of the gut and that pelvic flexure, you can certainly get impactions there. Another place you can get impactions, right where the cecum empties into the rest of the large intestine. That's a fairly narrow passageway, and that also can get impactions. Inadequate water, so the digestive flowing through the gut is drier than you want it to be. It's going to be more prone to impactions. Disruptions to the microbial populations, whether that be the soluble carbs or anything else that can, you're hearing a lot more about the health of the microflora in the horse's gut relating to the overall digestive health of the horse and actually the overall health of the horse. Any disruptions to the microbial populations increases the risk of colic in the horse. And then parasite infestation. One of the issues with parasite infestation, some of the parasites that live primarily in the gut, and I'm sorry, I'm not up on my parasites. I didn't refresh my parasite knowledge before this presentation, but some of them, it might be the bots that hang on to the intestinal lining and can really gather there right where the cecum empties into the large intestine. You get a whole big load of parasites hanging there that can increase the risk of impaction. And another thing that can happen if you've got a horse with a big parasite load and you really go after that infestation and deworm and get a bunch of dead parasites trying to flow through the gut, that could possibly increase your chances, or just the damage that the parasites can do to the lining of the GI tract, all of those things. So of course, for parasites, I think I've got it later on in here too, for parasites, work with your veterinarian, follow their recommendations on doing fecal counts and appropriate deworming protocols for your horse and your horse's situation to reduce the risk of parasites causing digestive or any other kind of problems. Okay, risk factors of colic. Abrupt change in diet within the previous weeks. This is from a study done by Noah Cohen and some other Pete Gibbs and A.M. Woods in 1999 at Texas A&M. And they just did a big survey and put together all the factors that increase the risk of diagnosis of colic in horses. And some things they came up with were kind of revolutionary that people hadn't really thought about. The first one, abrupt change in diet within the previous 2 weeks. I think in general, horse people know, don't make big dietary changes cold turkey. Slow the changes down, making them very gradually to reduce the risk of colic. But this next one, a recent change in hay. When people are thinking about making changes to the diet, they very rarely think about the change in hay. But what they saw in this study was a recent change in hay actually increased the risk of colic in horses by about 10 times. So that is a lot. And it is changing from types of hay, but it also can just be a change in quality of hay. So you get a different batch of the same type of hay. One batch was really high quality and the next batch is low quality, or vice versa. Those changes can actually increase the risk of colic in your horse. A history of previous abdominal surgery for colic. Anytime you have to open up a horse's abdomen, there's a big risk of adhesions or scar tissue. Horses aren't really good at abdominal surgery. So if you have to do it once, that increases the risk that you may have to do it again. So veterinarians usually try to avoid surgery unless it's absolutely necessary for the survival of the horse, and the horse has a good chance of recovering well from the surgery. A substantial change in weather conditions. This is what I mentioned, big changes in temperature, barometric pressure. Those are the times that vets just get called out on so many colics. We don't really understand exactly why. I have one veterinarian friend who is pretty convinced it's a change in water intake with the barometric pressure changes or the changes in temperature. Are they drinking less than they were before? I don't know at this time, but it's something to be aware of. And if there's something you can do, you know the weather's going to be changing drastically. Try to make sure all your other colic risks are addressed. Make sure your horse is well hydrated. You don't make any other changes. Keep them on kind of regular exercise protocol to keep the motility of the gut. So all those other things, because you really can't affect the weather conditions. A change in housing within the previous 2 weeks can increase the risk of colic. Let's see, you moved your horse from one place to another. That can increase the risk. Deworming within 7 days prior to colic. That's one of the things, if you work with your vet on fecal counts and make sure you're deworming properly, that should help you reduce that risk. Horses kept in stalls more than 50% of the time are more likely to colic than horses turned out more than 50% of the time. So turnout is good for the horse. Exercise, movement is good. And this one, I believe, increased the risk about doubled the risk. So something to just be aware of. And then change in activity during the 2 weeks before being examined for colic. They did see that was, those horses had a higher risk. Okay, so feeding management to help reduce the risk of colic. Number one, small meals often. In general, the recommendation is no more than 0.5 pounds of grain per 100 pounds of body weight per meal. So for a 1,000-pound horse, that is about 5 pounds of grain in a meal. For a 100-pound mini, that would be about half a pound of grain in a meal. But now I will say that kind of depends on the NSC content of the concentrate. So I have a picture of oats here because oats are about 50% starch and sugar. So oats are actually fairly high in starch and sugar. Corn is very high in starch and sugar. It's more like about 70%. So when you're talking about 0.5 pounds of grain, that's really kind of based on the starch and sugar content of oats. So here's a little chart that I stole from a friend, and it just kind of gives a little bit more of an idea if looking at the NSC content of the oats or a feed stuff and how much of that can you feed in a meal for an 1,100-pound horse before you're really increasing the risk of that soluble carb overload in the hindgut. And these three, the three columns here are 3 different recommendations of starch limit per meal. So primarily we're going to be looking at this first column because that relates down to reduce the risk of starch overload to the hindgut, limit starch intake to less than or equal 2 grams of starch per kilogram body weight per meal. And the other, this next one is for gastric ulcers. So this column is to reduce the risk of gastric ulcers. And this last one is for horses that are insulin resistant. They have been diagnosed with insulin dysregulation. And for those horses that are very sensitive to soluble carbs, then we try to limit the starch to 0.3 grams per kilogram body weight per meal. So that's very little starch. But depending on the starch and sugar in the feed stuff, so here with oats, 50% NSC to reduce risk of colic or overload of starch to the hindgut, we can feed about 5 pounds of oats in a meal. Now we know that oats are not a balanced diet for horses. They're just a good ingredient. So here's a balanced feed that's about 35% NSC. So that's a kind of typical commercial sweet feed, maybe with some fiber sources like beet pulp, maybe some added fat. So 35% NSC, you can feed more like 7 pounds in a meal to an 1,100-pound horse without risking the soluble carb overload in the hindgut. You get down into mid to upper 20s for NSC, and we're up to 9 pounds of feed, 17% NSC. Now we're getting into the low starch diets. And here we're at 13 pounds in a meal, and 15% NSC, 15 pounds in a meal before. This is a low starch feed. You could feed 15 pounds in a meal before you overload the upper gut and get soluble carbs into the hindgut. Now, I would never recommend feeding 15 pounds of a concentrate, even low starch feed, because we want to split the meals through the day. So if you're thinking about 30 pounds of feed per day, okay, if I owned a feed store, I would be happy to sell you that 15 pounds twice a day of feed. And my almost 35-year-old, he actually is getting not 15 pounds per meal. He's getting about 8 to 9 pounds per meal because he can't eat hay anymore. But it is an appropriate feed that's designed with the fiber to replace the forage in the diet. But that's just to show you that you could, without getting a starch overload with a low starch feed. That's not good feeding management, but it's just to show you. And then rice bran, actually, a lot of people are feeding rice bran, which is why that's thrown in there. Rice bran is not terribly low in soluble carbs. So it's more of in the 20 to 35% soluble carbs. So 8 to 9 pounds of rice bran. But again, that's not a balanced feed. That is an ingredient that is a little bit lower in soluble carbs than oats. But so it's not a big risk of, throwing in too many soluble carbs into the hindgut. Okay, so we've covered small meals often, and the best thing with these small meals is spaced gradually, evenly through the day. So if you're feeding 2 meals, preferably about 12 hours apart. In reality, a lot of horses are getting their 2 meals about 8 hours apart, but if you can, evenly through the day, if you've got a horse that needs more feed, more calories, maybe 3 meals spread through the day, preferably every 8 hours. And if you get into a horse that needs a huge amount of grain, some of these thoroughbred race horses are really, really working hard. If they're getting 4 meals, it would really be nice if they were every 6 hours, but telling somebody, can you get up at 2 a.m. and dump a meal of feed for your horse? Yeah, that's not going to happen. So within the realm of reality, that would be the best case. Feed appropriate quality and quantity of forage. I think we've talked about that. Consistency, make changes slowly. Feed, forage, and exercise. Gradually change. Cold turkey changes are never good for the horse's gut. If it's a small change, 3 to 5 days. If it's a big change, 10 days to 2 weeks, depending on how susceptible your horse is and how big the change is. Provide adequate water. Be aware of cleanliness. You want clean, fresh water available pretty much all the time. Be aware of the temperature of the water. If the water gets too warm, the horse is not going to drink as much. If the water gets too cold, the horse is not going to drink as much. And when they're not drinking, you have a higher risk of colic and other digestive disturbances. And then environmental risk factors. Can't always affect them, but be aware. Temperatures, weather changes, that type of thing. Again, be aware and try to mitigate all the other risks. And then work with your veterinarian on deworming programs, addressing gastric ulcers, and anything your vet can do to help with your horse's digestive health. That, of course, if you're having problems, that's your first place to start. Definitely work with a nutritionist if you can to make sure you're on an adequate diet and feeding management. And your veterinarian is always your first stop for any kind of problems and health issues. Okay, so some digestive health supplements that can be very beneficial in maintaining your horse's gut health. Equine is a really cool one because it's got a time-released hindgut buffer. So for instance, if you're worried about the acidosis that can happen in the hindgut, especially in situations where the horse is going to go onto the more lush pasture, and you're worried about those situations, Equine is designed to help mitigate and maintain the pH of the hindgut. Now, right track is one that I really like that because number one, it has Equine in it. So it's targeting the hindgut, but it also has buffers for the upper gut. So this is I think this is the only researched supplement that I'm aware of that actually addresses issues in the upper gut and the hindgut. So this is a really nice one. And one of the I recommend Right Track first to feed with the meals to help buffer. And it's one when you know the horse is going to have that high acidic situation. I would recommend maybe shortly before the horse is going to be in that situation, maybe you take your Right Track and add just a little bit of feed to make a small meal for your horse so that buffer gets in there, because the buffers in the stomach act almost immediately. So if you're in a situation that you know that there's going to be a lot of acid and you want to reduce that risk of the gastric ulcers, that little bit of Right Track can really help there. And Triactin is one, that's an interesting one because it has a marine-derived calcium source that is very bioavailable and is great for growing horses and supporting bone health. But that marine-derived calcium source is also a gastric buffer. So it can help with young growing horses to support the bone and also support and buffer the gastric acids. So that there are some really great places where you can use Triactin. So those are the three supplements that KER offers. Again, they're all research proven and very helpful for maintaining the digestive health of your horse. So take home message. The architecture of the horse's GI tract lends itself to digestive dysfunction. I had a professor in grad school that said he believes the horse's GI tract was put together by a committee because it really doesn't make a whole lot of sense. So again, equine gastric ulcer syndrome and colic are just, you got to be aware of them all the time in horses and feed and manage to mitigate that risk. So nutrition and management, feeding management can reduce the risk of digestive disturbances, and of course, work with your veterinarian to determine causes and treatments for horses exhibiting symptoms of poor digestive health. And finally, for additional help, KER.com, our equine nutrition advisors are available. You can get in touch with one of us nutritionists through KER. And I got to say, the amount of literature on the website, if you want to research something, I haven't even been able to go through all the articles on the KER website, so I highly recommend it. And actually, if you go to Dr. Google, a lot of times one of the first places that shows up is an article on KER.com. And when I see that, I'm going, okay, that's an article that's got basis in research and that I can trust. So the final take-home message, y'all, I think have heard my dog now a few times. There's Livy there looking at me with her face. But take-home message, WPRA members get 10% off KER products online. Use code WPRA21. And then the December promo is $15 off any order over $100. And for that one, use the code MARY2021. So thank you very much for your time. And if you'd have any questions, if you're looking at your computer screen like Livy was looking at me, please feel free to ask any questions.
Perfect. Thank you so much for all that information. That was a lot of really good stuff that I think, there's lots of questions on no matter what. So if you guys have any questions, feel free to comment. I have a couple questions that we'll go over as well, and I'll try to catch your comments as they come in. But talking about ulcers, how important, if you suspect your horse has ulcers or something like that, how important is an endoscopy to, to go forward with treatment? Or do you even think that there needs to be one before you start treating for ulcers?
You know, I like doing and having your vet do an endoscopy so you really know exactly what you're dealing with. And these days, there are some suggestions that are different for the glandular ulcers versus the non-glandular ulcers. So an endoscopy will help you figure out what is actually, you may not necessarily know, especially if they're glandular ulcers, exactly what's causing them, but it really can help your vet in going down the road for which treatment, because traditionally we've been using omeprazole for years and years, but there are other medications that can be used in conjunction or instead of omeprazole, that there is some research that's showing the combinations or the other medications may be more effective for those glandular ulcers. So in that situation, an endoscopy can be very helpful so that your vet really can hone in on what they prescribe to treat those ulcers.
Perfect. Okay. And then, treating a lot of those would be kind of through, buffers or, how omeprazole is a buffer, prolonged use of that you kind of spoke about, that could be, a bad thing. Why is prolonged use of like omeprazole or some kind of, buffer treatment for, stomach ulcer a bad thing?
That's a good question. And the omeprazole is actually not a buffer. It actually causes the hydrogen, it's a proton pump inhibitor, which causes the hydrogen chloride, the acid, to not be produced. So it stops the production of the HCl. So it's not buffering, it's causing the acid to not be there. And if you don't have acid, then you don't have ulcers. However, the acid has a role in digestion. And so that's why you don't want long-term cessation of acid production. It's not healthy for the horse. So that's why it's recommended for the treatment with omeprazole is 30 days. And then you want to gradually reduce the amount of omeprazole, because if you suddenly shut it off, then you can get an acid rebound and it can just trigger the formation of those lesions again. So that's why you don't want a long-term use of omeprazole. But the buffers, on the other hand, for instance, the buffers in right track or the gastric buffer in the triactin, those prolonged use, you're still getting normal production of acid, but those just take the pH down. Well, they bring the pH up to a more, not all the way to a neutral level, but in general, they take it up to about a 4 or maybe a little bit above, which is kind of the alfalfa. Feeding them alfalfa also brings the pH up so that it's just not as corrosive to the lining of the hindgut. So long-term use of a supplement that buffers the acid is a very different thing than long-term use of a drug such as omeprazole, which actually affects the functioning of the glands in that stomach. Does that make sense?
Yeah, that's perfect. And that's a really great differentiation to make, is that, there's things that actually shut down the pump versus things that help with the stomach acid itself.
Just buffer the acid.
Okay. Perfect. And then, there are all these different kinds of risk factors for, colic and stuff. So if you know that there's a risk factor coming, it kind of sounds like the best thing to do is just to make sure that you're covered kind of on all your other management of those other risk factors, if that makes sense.
Exactly. Yep.
Perfect. Okay. Well, I think that's what we have for today. Those were all the questions that I had, and it looks like there was just some people watching from Australia that said thank you. So that's super cool that we have people from Australia.
That's fun.
But yeah, so thank you all for joining us. Don't forget, to snag up that December promo. WPRA members get 10% off all the time. So make sure you head over to Kentucky Equine Research's website and do some shopping. I know I will be. And if you have any other questions, feel free to message either the Kentucky Equine Research page or the WPRA page, and we'll get you an answer and connected with someone that can help you. So thank you so much for joining us again, and I'm sure we'll be talking to you again soon. Alrighty. Bye, everyone.